Can a fungal scalp infection cause your hair to fall out? Yes. And if you're noticing patchy hair loss, especially in a child, it's worth knowing exactly what you're dealing with and what to do about it. Scalp fungal infections are more common than many people realise, particularly in school-aged children, though they can affect anyone. Because the symptoms can look a lot like dandruff or eczema, they're often missed or misidentified. Getting the right diagnosis early really does make a difference. So let's talk about what's actually happening, what to look out for, and what treatment involves. The medical name for this condition is tinea capitis, sometimes called ringworm of the scalp, though it has nothing to do with worms. It's caused by a group of fungi called dermatophytes, mainly trichophyton and microsporum species. These fungi break down keratin, the protein that makes up your hair shaft. As they invade the hair follicle, they trigger inflammation that disrupts normal hair growth, causing hair to break off or fall out in patches. The appearance can vary depending on the type of fungus. Trichophyton infections tend to cause a black dot pattern where hairs break off right at the scalp surface. Microsporum infections often produce grey scaly patches with dull broken hairs. Both can cause itching, scaling and noticeable hair loss. One complication worth knowing about is something called a kerion, a painful boggy swelling on the scalp that develops when the immune response to the infection becomes intense. A kerion needs urgent medical attention because if it's left untreated, it can cause scarring that permanently damages the hair follicles. Now, one of the most important things to understand about treatment, antifungal shampoos alone are not enough. The infection lives deep inside the hair follicle, where topical treatments can't reliably reach. Oral antifungal medication is required, and the specific medicine depends on which fungus is responsible. Terbinafine is typically used for trichophyton infections, while griseofulvin is more commonly used for microsporum. Antifungal shampoo is used alongside oral treatment as an adjunct to help reduce the spread of spores, but it's the oral medication that does the heavy lifting. The exact medicine, dose, and length of treatment are determined by your prescribing clinician or pharmacist. This isn't something to self-medicate. If you or your child is prescribed treatment, it's important to complete the full course as directed. Stopping early can allow the infection to return. A couple of important safety points around griseofulvin specifically. It is contraindicated in pregnancy, and it can reduce the effectiveness of hormonal contraceptives. Make sure your doctor or pharmacist is aware if either of those applies to you. And if you notice any unexpected side effects from antifungal medication, these can be reported to the MHRA through the yellow card scheme. Your pharmacist can help with that. If you're seeing patchy hair loss, scalp scaling, or persistent itching, particularly in a child, it's worth getting it checked by your GP. They may take a scalp scraping or hair sample to confirm the diagnosis and identify the specific fungus, which helps guide the right treatment choice. And if you notice a painful, swollen area on the scalp, seek medical advice promptly. That could be a kerion. On the question of school, current UK guidance states that children do not need to be kept off school once oral treatment has started and antifungal shampoo is being used, so there's no need to disrupt their routine once treatment is underway. As for hair regrowth, it does take time. Regrowth typically begins within 6 to 12 weeks of starting effective treatment, with full cosmetic recovery potentially taking up to 6 to 12 months, so patience is important. To recap, tinea capitis is a fungal infection of the scalp that causes patchy hair loss and scaling. It requires oral antifungal treatment, not just shampoo, and the right medicine depends on the type of fungus involved. With prompt, appropriate treatment, the majority of people do regain full hair growth. Please speak to your GP, pharmacist, or a qualified healthcare professional for advice tailored to your situation. Nothing in this video is a substitute for personalised medical guidance. If you found this helpful, leave a comment below. And if you'd like more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.